Ladies, this is not a glamorous topic, but it's one we absolutely must talk about. If you're over 60 and quietly struggling with certain bathroom issues, you're not alone. But here's the problem. Too many of us feel embarrassed, so we say nothing. And that silence, it could be dangerous. These 5 embarrassing bathroom issues might seem minor, even normal, but doctors warn, ignore them, and they could signal something far more serious. Stick with me through the end. I'll also tell you the one red flag I ignored for too long and what it nearly cost me. Oh, and please like this video, subscribe, and comment below if you've ever felt too embarrassed to tell a doctor something health-related. Let's break the silence together. 1. Straining too much during a bowel movement. Let me tell you something I wish someone had told me earlier in life. Straining on the toilet every day isn't just uncomfortable. It's your body waving a little red flag. Many of us older women fall into this trap. We think constipation is just part of getting older, part of eating less or moving slower. But let me be clear, it's not normal to be pushing and grunting every time you have to go. And it's certainly not something we should ignore. I was guilty of this myself. I'd sit there, holding onto the sink, straining like I was giving birth again. I'd finish feeling exhausted, sometimes even dizzy. I told myself it was just because I wasn't drinking enough water or that I needed more fiber. And sure, those things matter. But the real issue was much deeper. My pelvic floor muscles weren't functioning properly. What many women don't realize is that excessive straining can actually weaken those muscles even more. And that can lead to bigger problems like hemorrhoids, rectal prolapse, or difficulty holding in gas or stool. Not exactly glamorous topics, I know, but they matter. And here's another thing I learned. When you strain all the time, you're also increasing pressure on your heart and blood vessels. In fact, doctors warn that straining can even contribute to dangerous spikes in blood pressure, especially in older women with existing heart conditions. I was lucky. I saw a pelvic floor physiotherapist who taught me how to use my muscles properly, how to breathe through it, how to engage the right muscles, and stop pushing like I was trying to lift a boulder. And the difference was night and day. So if you're finding yourself in the bathroom, holding your breath and pushing for dear life, please talk to your doctor. You don't have to live like that. 2. Feeling like you never fully empty your bladder. Here's something we almost never talk about, even with close friends. You go to the bathroom, you do your business, you wipe, you flush, and yet just a few minutes later, you're back. Again, that nagging feeling like you didn't really finish. Like your bladder is playing tricks on you. I used to think I was just imagining it. Maybe I was distracted or anxious. But when it kept happening day after day, I finally said something to my doctor. And I'm so glad I did. Turns out, this isn't just a small bladder or part of aging. It can be a sign of something much more serious. When your bladder doesn't empty completely, urine sits inside longer than it should. That creates the perfect environment for bacteria to grow, and that can lead to urinary tract infections, ones that keep coming back, or worse, spread to your kidneys. And in older women like us, UTIs don't always show up with burning or urgency. Sometimes they show up as confusion, fatigue, dizziness, or even a fall. I've seen it happen. In my case, the cause was a mild bladder prolapse. That's when the bladder drops from its normal position and presses against the vaginal wall, making it harder to fully empty. It's more common than you think, especially in women who've had children or who've lost muscle tone over time. The good news? There are solutions. Pelvic floor exercises, certain medications, even simple lifestyle changes like adjusting your position when sitting on the toilet can help. Some women benefit from using a small step stool under their feet or leaning slightly forward. But the first step is awareness. If you're finishing your bathroom trips and feeling like you need to go again 5 minutes later, that's your body whispering, something's not right. Don't brush it off. Bring it up. Get checked. You deserve peace of mind. And an empty bladder. 3. Accidental gas or stool leakage. This one is probably the hardest to talk about. I used to dread going out in public, weddings, dinners, even simple walks, because I never knew when it might happen. Just a little slip of gas that came out without warning. Sometimes worse. I remember once being at the grocery store and feeling something I couldn't control. I rushed out with tears in my eyes, leaving my cart right in the middle of the aisle. It was humiliating. I felt like I was losing control of my body. I kept it to myself for months. I was afraid to even bring it up to my doctor. I mean, what do you say? I can't hold in gas anymore. But when I finally did, she looked me right in the eye and said, "You'd be surprised how many women your age are going through the same thing." You see, accidental gas or stool leakage, what doctors call fecal incontinence, is very common in older women. It can happen because of nerve damage, weakened pelvic floor muscles, or even past childbirth injuries that only now, decades later, are catching up with us. And here's the thing, there are treatments, real ones, not just pads and planning, physical therapy, dietary changes, medication, even non-invasive procedures can all help, but we can't get help if we're too ashamed to ask for it. One tip I'll share, keep a diary for a few days. Write down what you eat, how your bowel movements are, and when accidents happen. That little bit of information helped my doctor pinpoint what was going on with me. And now I have so much more control. I'm back to enjoying social events without fear. And you can be, too. For blood in the stool or on the toilet paper. This is the one we really try to ignore, isn't it? You see a little red on the toilet paper, maybe a faint streak in the bowl, and you tell yourself it's probably just a little tear or a hemorrhoid. No big deal. But let me tell you something that shook me to my core. A friend of mine, and did the exact same thing. She noticed blood a few times, shrugged it off, and kept going. By the time she finally went to the doctor, she was diagnosed with stage 3 colorectal cancer. She was only 67. She hadn't told a soul, not even her husband. You see, blood in the stool, no matter how little, is never something to brush off. Yes, it could be hemorrhoids. Yes, it could be a small fissure from straining. But it could also be something that's been silently growing for months or even years inside your colon or rectum. Dark red or black stool is especially concerning. It may mean the bleeding is happening higher up in your digestive tract, and by the time you see it, it's already serious. But even bright red blood needs immediate attention. I know it's uncomfortable to talk about, but let me be perfectly honest. Your doctor has seen it all, and they want to catch things early before it becomes something life-threatening. When I finally spoke up after noticing a few specks of blood, my doctor took me seriously. I had a colonoscopy within weeks. Thankfully, mine was just hemorrhoids, but I walked away with peace of mind and a much better understanding of my digestive health. So if you see blood, even once, don't wait. Don't be brave. Don't be shy. Be smart. Be proactive. Your life might literally depend on it. 5. Sudden changes in bowel habits, especially diarrhea. Let me ask you something that might sound silly. Have your bowel movements changed lately? Are they more urgent, looser, or unpredictable? You'd be surprised how many women our age quietly deal with this and assume it's just aging. But when diarrhea shows up suddenly or alternates with constipation, and it keeps happening, it's your body trying to get your attention. I had a phase like this a few years ago. I was waking up and rushing to the bathroom within minutes of getting out of bed. Sometimes I wouldn't make it in time. At first, I blamed my nerves or something I'd eaten. Then I blamed menopause. Then stress. But it kept happening, randomly. Sometimes I'd go twice before noon, then not again for a day and a half. Finally, I got tired of guessing and brought it up to my doctor. She asked questions that made me pause. Had I recently taken antibiotics? Yes. Had I changed my diet or started any new supplements? Yes again. We discovered that my gut bacteria had been completely thrown off, something called post-infectious IBS. Totally treatable. But I wouldn't have known that on my own. But that's not all this symptom could mean. Ongoing diarrhea in older adults can be a sign of irritable bowel syndrome, inflammatory bowel disease, or even colorectal cancer. It can also lead to dehydration and malnutrition if left unchecked. And here's something most women don't realize. Frequent diarrhea can weaken your pelvic floor muscles over time, just like straining does. It also raises your risk of accidents, infections, and poor nutrient absorption. It's not just annoying, it's dangerous. So if things have changed in the bathroom lately, especially if you've started rearranging your day to stay near a toilet, don't ignore it. Keep a log, talk to a doctor, and get some answers. I promise, there's no shame in being proactive with your health. But there's a lot of regret in waiting too long.